Hello everybody and welcome to this webinar focusing on the online MSc in Global Mental Health at the University of Glasgow. So my name's Julie Langan-Martin and I'm the Programme Director for the Online Distance Learning MSc in Global Mental Health. So what I was going to do in this session was talk a little bit about the University of Glasgow and the School of Health and Wellbeing where the Online Distance Learning Masters in Global Mental Health sits. We'll talk a little bit about the benefits of studying on an online distance learning programme, and we'll touch on the Global Mental Health curriculum and its content. We'll talk a little bit about some of the key features of the online learning environment, and I'm very happy to answer any questions that might come up during the session. So if you just pop them in the chat, we'll take questions at the end, and a recording of the webinar is available as well. So as I said, my name's Julie Langan-Martin. I'm the Programme Director for the Online Masters in Global Mental Health, and I'm a Senior Clinical Lecturer in Psychiatry within the School of Health and Wellbeing. So that means that 2 days a week, I actually work clinically as a consultant liaison psychiatrist in NHS Ayrshire and Arran. So that's really good to have the clinical clinical work, which I really enjoy. So my primary interests are in global mental health and the interface between major mental illness, so things like schizophrenia and bipolar disorder, and the impact that this might have on people's physical health and well-being. And I'm also interested in ECT, or elective convulsive therapy, as a safe and effective treatment for people with severe depression. I'm a fellow of the Royal College of Physicians and Surgeons of Glasgow, and I'm a member of the Royal College of Psychiatrists. So the University of Glasgow was established in 1451, and 80% of our research was judged to be internationally excellent back in the REF in 2014. And we've been ranked first in the Russell Group for teaching in the NSS back in 2018. And we continue to be ranked in the top 100 of the world's universities. So we really love being within the University of Glasgow. We've had a number of famous University of Glasgow alumni. So, for example, John McIntyre opened the world's first X-ray department at the Royal Infirmary back in 1896. And then John Logie Baird invented the television in 1926. So we've got lots of famous University of Glasgow alumni that have, made major impacts across the world. So the School of Health and Wellbeing is one of the schools that sits within the College of Medicine, Veterinary and Life Sciences. And our mission is to prevent disease, improve health and wellbeing, and reduce inequalities at a local level, at a national level, and also globally. And within the School of Health and Wellbeing, we have an Athena Swan Gold Award, which we were awarded in 2018, and we just recently renewed our Gold Award. And this is for equality and diversity, with a specific focus on gender equality and diversity, but we do look broader than gender equality. Within the school, we have lots of connections to the Scottish and UK governments. We work closely with the NHS, with the National Health Service, and also with local authorities, as well as voluntary and private sectors. And the institute or school has been at the forefront of some major public health interventions. So we were really at the forefront of investigating the impact of the smoking ban when that first was introduced several years ago in Scotland. And more recently, people might be aware of some of the research that was led by members of our school staff, focusing on heading football. So this idea that if you potentially head footballs, if you are a professional footballer, that this can increase your risk of neurodegenerative brain disorders in later life. And this has actually led to changes in policy with regard playing football for people of certain ages, and rules about heading balls and things like this. So lots of really interesting and kind of world-changing research happening within the School of Health and Wellbeing. So really exciting that our programme sits within the school, and we have access to these researchers that contribute to many of our courses and teach on our programmes within the school. So why this programme? So I've touched on, hopefully already, the idea that you would benefit from being exposed to learning materials that are research informed, research led. We are constantly reviewing and updating our learning materials to ensure that we are up to date and that we're always at the cutting edge in terms of topics and first-hand insights. We have a range of international experts who contribute to our programmes, and we have speakers with lived experience of mental illness, for example, who have contributed to our learning materials. We're also very multidisciplinary and interdisciplinary. So although I'm a consultant psychiatrist, we have lots of other lecturers within the school who contribute to our teaching materials, and we're very collaborative in terms of how we design and we create our learning materials to make sure that we are hearing from all voices that should be heard within our within our learning materials. We focus on the impact of social and cultural factors on awareness and treatment with regard to global mental health. And recently, a number of our global mental health alumni have been undertaking a project thinking about how we can decolonise our curriculum. So thinking about how we need to amplify voices that maybe haven't been heard, and just ensure that we are ensuring that our curriculum is as inclusive as it can be. We also focus on global mental health treatment, and we think about the treatment gap, and this is high on the agenda of the United Nations and the WHO, and we collaborate, as I said earlier, with various institutions, with the NHS and third sector organisations. So we hope that the programme is up to date, innovative and dynamic, and we're certainly always keen for feedback just to improve our courses moving forward. So the learning outcomes of the programme focus on addressing global inequalities in mental health and service provision. We always encourage our students to think really critically about the challenges that are associated with globalising ideas around mental illness. And we do encourage students in all aspects of their learning to just think critically and always have that critical hat on. We encourage people to develop and think about how we might implement policies to reduce the burden of mental illness. And we think about how we can integrate initiatives into wider international development aims. And we encourage students to think about how you might forge your own mental health policies, strategies and services in your own background and where you are living and working. So in terms of the actual programme structure, so the online distance learning masters has 3 core courses. And if you're doing the full masters, we ask you to undertake a dissertation. So each of our courses are 20 credits and they run over 11 weeks. So we have 5 weeks of teaching or learning materials, then we have a reading week, and then we have 5 weeks. So they run over 11 weeks. The first core course that many students will undertake is called Themes in Global Mental Health. And this does kind of what it says it would do, or what you might imagine it would do. So we're introducing kind of foundational concepts within the field of global mental health. So we think about, well, what is mental health? How do we define mental illnesses? What classification systems are available to help us recognise symptoms that might be recognisable as mental health disorders? We think about how culture might impact on presentations of mental ill health across the world. We think about social determinants of health. We then spend time thinking about recovery and what recovery might look like in people who have had mental illnesses. We think about different treatment options that are available, and then we think about the treatment burden and the treatment gap and how we can address these. And we always link to the sustainable goals, the sustainable development goals. The other core course is Research Methods in Health and Wellbeing. So this is a foundational course which introduces a range of research methods. So we're thinking about quantitative research methods, thinking about qualitative research methods that might be used. We spend time thinking about some of the ethical kind of dilemmas and the importance of ensuring that our research has the correct ethical permissions in place. And we also spend a little bit of time thinking about health economics and how some research can be costed and things like this. And then the final core course is Mental Health and Disability, International Law and Policy. So again, during this course, we think about international laws regarding mental health acts across the world and how the WHO recommends a mental health law is generated and created. And we think about mental health policies across the world. We also spend some time thinking about stigma and the important impact that stigma can have on mental health and mental illnesses across the world. And then your dissertation project is undertaken as your final core course after all the taught courses are complete. And this dissertation is usually student-led, and you'll be matched with a supervisor who will help support you undertake your dissertation project. So in addition to your 3 core courses, students are able to undertake 3 optional courses. And these are listed here. I'll not read them all out and go through them all, but I think the key point to take away is that there is a lot of options within the global mental health course. So there's, if you're particularly interested in, say, for example, health technology assessments, there's opportunity to undertake some health technology assessment courses. If you're interested potentially in more thinking about culture and social and biological determinants of mental health, there's a course that you can focuses on that. If you're more interested in mental health promotion, again, we have a mental health promotion across the lifespan course. We also have courses focusing on globalization and public health, and we have more in-depth qualitative research methods course, for example, as well as a more kind of quantitative course where there's an introduction to epidemiology and stats. So a huge diversity of optional courses that are available for you to choose depending on your own research interests or maybe your own kind of backgrounds and where you see yourself following completion of the Global Mental Health Masters programme. So lots of choice there, which I think is really good. In terms of career opportunities, so we're really fortunate to have a really excellent, diverse group of students who undertake our courses. And we've had a huge number of successful students who have gone on to a range of careers, for example, in national mental health policy and planning. Some people have gone on to undertake epidemiological research or got involved in mental health services research. We've other students who've gone on to take advisory and advocacy roles in governments or in international organisations or in non-governmental organisations. So we are so honoured to have such diverse students that take our courses and then go on to have really successful careers globally. In terms of kind of some of the practicalities, so our entry requirements for the programme is at least a 2-1 honours degree or equivalent in a relevant subject. So things like psychology, medicine, nursing, occupational therapy, law, public health or public policy. But we are a little bit flexible in terms of the subject that people might have undertaken, because we recognise that sometimes people might have done an undergraduate degree in something and then their life has happened and they're thinking about a career pivot. So we are open to students who are maybe from more diverse backgrounds. So we've previously had students from anthropology backgrounds, for example. We have had students from more sciencey backgrounds. So people sometimes have done a biomedical degree, things like this. So if you think you might be interested, please reach out and get in touch. These are not completely prescriptive, but they do give you an idea of where many of our students come from. We do allow people with a healthcare professional qualification into the programme as well. And as I said, a background in mental health is not essential, it's desirable, but we recognise sometimes people have, changing life experiences and their career moves in a different way. For international applicants, we ask that you have an IELTS score of 6.5 with no less than 6 in any band. So I just wanted to touch on the online environment itself. So all the online learning materials are hosted on a platform called Articulate Rise, which students really have given us great feedback about this. They really enjoy it because there's lots of interactive learning resources that are available, and they're kind of diverse in terms of their nature. So we have some videos, we have quizzes and things like this embedded within our learning materials. The assessments that we have within the programme are linked to our graduate attributes. So we are big advocates within our programme of having what we call authentic assessments, which are much more helpful, we feel, for people when they'll be working. So instead of asking you to do exams or to write, long essays, sometimes we ask students to create a poster, we ask students to create an information sheet, we might ask students to record a podcast, or write a blog. So lots of diverse types of assessments. We do ask students to sometimes write essays, but I suppose the key point I'm keen to get across is that we're not always asking students to do the same type of assessment over all of our courses. And we, so just in terms of going back to the learning content, it's downloadable as well. So you can study offline if that's something that you might think would be helpful, and it's accessible across a range of devices, because we're recognising that maybe not everybody's wanting to use a laptop all the time, maybe a tablet device and things like this. So the learning materials are accessible across a range of devices. So in terms of key facts, so I spoke earlier that the courses are 20 credits and they run over 11 weeks. And we ask students to undertake one course a semester. So our semesters run in January, April and September time. And there is this study week or the 1 week break where students use that as a kind of catch-up week. Usually we recommend that weekly study is about 20 hours to undertake the learning materials, and then there will be self-directed learning time as well within that. The duration of the online distance learning programme is usually between 2.5 and 6 years. So students can undertake the course within the 2.5 years, but we do find sometimes that most of our online distance learning students might take 3 years or 3.5 years, because they may just find balancing different aspects of their life can be a little bit challenging. So there is flexibility within the programme. So if you need to take a semester off or something like that, that's absolutely fine. In terms of the cost, so the programme itself is £15,000 and that's then calculated as £1,667 per 20 credits. We do have a discount available for NHS funded students, and the course is 100% online, and all our learning materials are accessible. A lot of them are asynchronous, so they can be looked at in your own time and downloaded and things like this. So I'm happy to stop there and take any questions that anybody might have. So thank you very much for listening, and I hope you will consider applying to our Global Mental Health Master's Programme. Shall I stop sharing?
Oh, you can keep sharing it if there's any information on there that anybody wants to see. You can keep it up. Yeah, if there's any questions, if anybody doesn't want to come onto camera or turn their mics on, feel free to just pop your question in the chat. But we do have a couple of questions I'd like to run through with you, if that's okay, Julie.
Yeah.
So basically, there's a question about study hours. So how many hours are students looking at for self-studying during one module, so one course?
Yeah, so I mean, I think this is very variable, and it's yeah, I mean, it can vary very much depending on the student. So usually we would be recommending that for a 20 credit course, we would recommend that there be 400 notional hours of learning associated with a 20 credit course. So that can be spread out over the 10 weeks quite evenly, or in reality what happens is that often when assessments are due, maybe students are studying or working a bit harder around about assessment deadlines. So the general kind of recommendation is 400 notional hours per 20 credit course, which I totally accept is quite a lot of study time. So it's just something to be aware of, that master's level study does equate to quite a lot of notional hours of learning. I think in reality students maybe don't manage all those hours, or even for full-time students, I think managing that level of studying can be tricky. So it is possible to do less, but that is the recommended number of notional hours.
Is it possible to work part-time or full-time alongside doing the course?
So a lot of our students, especially our online distance learning students, do work full-time or part-time while undertaking part-time online distance learning study. So it definitely is possible. I think what I would say is that it's definitely possible, and we're very supportive of students who are working while they're studying, but it is important just to make sure that you're organised, I suppose, in terms of protecting or having kind of ring-fenced study time available for the master's programme, because there is quite a lot of work to be done, learning materials to be looked at and assessments to be created and submitted. So yeah, it is possible, but just be, I suppose, mindful that you're looking after yourself as well and not kind of overstretching.
When do students get their assessment deadlines, and how much time do they get to do their research and do the courses, the material online, ahead of completing that assessment?
Yeah, so most of our courses have 2 pieces of assessment for each course. So we are very keen that feedback from students has been that they don't particularly like high stakes assessments. So this idea of 100% assessment in one piece of work. So we've moved to most courses having 2 pieces of assessment. So we're always very keen, and we strongly ensure that the assessment dates are available when the course is launched. So you'll know when your assessments are due the day you enroll in the course, that all the assessment material and the assessment information is there. We've done a lot of work in ensuring that there are examples of previous assessments for students to have a look at, and we always ensure the feedback sheets available, that so you can understand what we're looking for in terms of the when we're marking assessments. So all that information is available from the get-go. So different modules have slightly different deadlines within their assessments, but generally we have the first assessment coming in probably around about week 6, week 7, and then the second assessment will come in after the 11 weeks of teachings is completed. So usually around kind of week 11, week 12. So again, there's lots of time to plan out and map it out in your diary and things like this. And we always try and ensure wherever possible that the feedback for assessment 1 is released, and you're able to have a look at that before assessment 2 deadline is required to be submitted, so that you can feed forward any feedback or any kind of points for improvement into the second assessment.
That's excellent. Do students get to see examples of dissertation projects when they go into year 3?
Yep, absolutely. So we have several student dissertation projects available on our kind of Moodle Hub page that students can have a look at. So we've got a range of grades. So we've got a number of grade A projects, grade B projects, grade C projects, and a number of different types of projects. So we have students who have undertaken a systematic review, for example. So, we've got examples of that there, or maybe some students undertake primary data collection. So again, we've got examples there. So yes, there's lots of available examples for students who've undertaken previous dissertations to have a look at.
Is there any opportunities for students to engage with one another?
Yeah, so within our learning materials, we have lots of note-taking activities embedded within that. So these are key kind of learning moments that we ask students to kind of spend a bit of time reflecting on. And we link our note-taking activities to Microsoft Teams. So once you're kind of launched on Moodle, every course has a Microsoft Teams page where students are enrolled in, and we have different sections within the Microsoft Teams. So we've got all the weeks where all the note-taking activities would be. There's a general kind of space for if there's any assessment questions, and then there's a more kind of social space where students can maybe chat with each other. So there is an opportunity for students to kind of engage on Microsoft Teams.
Excellent. Do students get reading lists?
Yeah, so absolutely. So all our courses have reading lists available that students are able to, again, get at the start of the course and are able to have a look at. The other thing is our learning materials, when we're maybe talking about, say, for example, in themes in global mental health, we might be talking about ICD-11, and within the course materials, the ICD-11 will be cited and it'll be hyperlinked through the reading list as well. So if you want to have a more in-depth look at, for example, ICD-11, you can just click on the hyperlink and that'll take you through the library, through the reading list to the ICD-11 resource. So again, students find that really helpful. But yeah, absolutely, we've got very robust reading lists available.
Sounds excellent. Are they able to come onto campus and use any of our facilities if they are local or visiting Glasgow?
Absolutely. So students are able to use the facilities if they're local or they're visiting Glasgow. So we have had some students who've maybe been studying. I had a student a number of years ago who was studying in Lebanon, and he was over in Glasgow for a work-related activity, and he actually came to the university and we were able to meet and have a chat, which was really nice. Having not met the person, obviously in person, face-to-face, but having had contact online, it was really nice that he, was able to come to Glasgow and we were able to meet, spend some time looking around the campus and things like this. So absolutely, students are able to, if they're local, access the library and things like this, or when they're visiting, they're able to come and see the buildings and whatnot.
So we have a couple more questions here. Can students graduate in person then?
Absolutely, yeah. So again, we have had several of our online distance learning students come over and graduate in person. So our graduations, we have summer graduations and we have winter graduations. Most of our MSc students graduate in winter, which is quite a nice time of year for graduation actually. And again, so a couple of years ago, so we tend to have an event within the School of Health and Wellbeing where so we have another big master's programme, the Masters of Public Health students. So we have a kind of joint School of Health and Wellbeing graduation event, and we invite our online distance learning students and our on-campus students and our PhD students to come to our School of Health and Wellbeing graduation event, and we always take part in the academic procession as staff members, and it's lovely. I really enjoy graduation. I think it's a lovely end of kind of year event. So absolutely, our online distance learning students are able to come over, and it's something that's happening more and more, which is really nice. And just last year we had I think 3 of our online distance learning students came and graduated in person, so it was really nice.
Yeah, that's so lovely. It's such a nice way to celebrate all the hard work and dedication that students have put in after their years of studying online, and then also get to come to Glasgow and visit the campus and get to meet their teachers as well, all the lecturers. So yeah, sounds like a lovely way to end it. We have one more question. So this question is, are there any in-person events or guest speakers that come for the programme throughout the 3 years?
So we have lots of events that happen within the School of Health and Wellbeing that we invite our students to come along to. We're really fortunate within the School of Health and Wellbeing. We have recently moved into our new building, the Clarice Pears building, which is just off University Avenue. And it's a really nice building. It's a really lovely building. But one of the key things that I found really helpful about the Clarice Pears building is it's quite well set up for hybrid events. So that means that, obviously we're having an in-person event, but it might be on Zoom, so that students who are maybe, not in Glasgow, or if students are, working at home or working kind of, flexibly, are able to attend these online events. So absolutely, we have in-person events and we have hybrid events. We've actually got a careers day happening on the 8th of May, which our online distance learning students are invited to, and we're running it as a hybrid event so that both, so that our online distance learning students can come along. So yeah, so we run lots of different events throughout the year that tend to be in hybrid form, so that we can ensure that we're, that we're allowing as many students as possible to attend. And we tend to we do often record these events as well. So again, they'll be available if you can't come, because say you're at work or something, it'd be available as a recording and you can watch it back. So yeah, lots of events, which is quite nice.
Sounds lovely. And we can have all those links added to the programme page as well, just to make sure that they're accessible for students. I think that's all the questions that we've got today. As I say, this session's going to be recorded and sent out to everybody who's registered for the event, and I'll also add a link to YouTube and to the programme page as well, so that everybody can access it freely in their own time. Thank you so much for your time today, Julie, and for going through all of that. I know our students are definitely going to appreciate it. But yeah, that's everything for now.
No problem. It's a real pleasure. All right. Thanks a lot.
Thank you so much. See you later.
Bye now.